health experts believe that the days are numbered for this CDC advisory committee. The Healthcare Infection Control Practices Advisory Committee, or HICPAC, is responsible for developing guidance to prevent and control infections in healthcare settings. But members have received termination notices, and the committee's webpage has been archived. If the committee is disbanded, sources say there is no doubt it would lead to more healthcare-associated infections.
We've heard from several HICPAC members who received termination notices, though not all of them did. The ones who didn't were expecting to receive them any day now. They said it's known that HHS Secretary Robert F. Kennedy Jr. is looking closely at advisory committees like theirs, and combined with the fact that the HICPAC section of CDC's website has been archived, they're pretty sure the committee's days are numbered. HICPAC has been developing guidance for preventing and controlling infections in healthcare settings. They have guidance on everything from disinfection and sterilization practices to hand hygiene. These guidelines aren't mandatory, but hospitals across the country rely on them for best practices. HICPAC has actually been in the spotlight over the past few years, as some critics have drawn attention to its draft revision of its isolation precautions guidance. Some weren't happy that the group recommended surgical masks over N95 respirators in some settings, for instance. Now, the group has put in a lot of time on that guidance, and they've been working on revisions to make all stakeholders happy, and now all of that effort stands to be lost if the committee is canceled.
Can Kennedy really just cancel the whole committee just like that?
He actually can. Lynn Jones Bastian, the Director of Policy and Practice for the Society of Healthcare Epidemiology, told me that HICPAC is regulated under the Federal Advisory Committee Act, which requires renewal of its charter at a certain interval. This is different from the way that the well-known Advisory Committee on Immunization Practices, or ACIP, operates. That was established in 1964 under the Public Health Service Act, and it would require an act of Congress to disband, Bastian told me. HICPAC just does not have that same level of protection. And if HICPAC is gone, sources said no doubt there would be more healthcare-associated infections.